Hi class, I will be sharing a short presentation on a paper that I wrote entitled, What Do You Know About Hospice Care? A short presentation from a hospice nurse's perspective for my public communication class. When you hear the word hospice care, what's the first thing that comes to mind? Death? Cancer? I know for me, as long as I have worked in the medical field, I knew the term hospice, but never really knew what it all entailed. What are the specifics of the care that's provided? In this short presentation, I will be covering my experiences as a hospice nurse, myths about hospice, and frequently asked questions. I have decided to talk about hospice because it's always a topic of discussion when I share with others what I do for a living. Who am I? First and foremost, I would like to introduce myself. My name is Yvonne. I have been a licensed vocational nurse for 6 years, but before becoming an LVN, I was a CNA, also commonly known as a patient care assistant, for about 13 years. I like to say that nursing is definitely not for the faint at heart. It is definitely not for just anybody. Yes, you will work with respiratory secretions, feces, urine, blood. You will also work with drug addicts, child abusers, and even abused babies. Just know that nursing does not discriminate. I myself have worked in skilled nursing facilities, locked psychiatric facilities, immigration detention centers, jails, hospitals, medical clinics, dialysis clinics, the list goes on. About 3 years ago, I was looking for a change of job. I thought for sure my calling was working in a jail. And after passing all the extensive, intense background checks that took months to clear, I got the job. I thought I'd retire. Boy, was I wrong. I left after a few months because it literally drained my soul. I came across this job opportunity that paid me more than working as a correctional nurse. I interviewed, and the next day I got the job. This began my career as a hospice nurse almost 4 years ago. What is hospice? Hospice care is an option for anyone with 6 months or fewer to live. When you receive hospice care, the goal will no longer be to treat your illness or extend your life. Rather, it will be to relieve your pain and make the time you have left as comfortable as possible, also while in the comfort of your own home. Initially, I didn't know what to think. I had never worked in home health or been a field nurse. I thought I'd walk into people literally dying and everyone crying around them. Common myths about hospice. Myth. Hospice and palliative care are the same. While palliative care is definitely an additional medical and social support for people at any stage of illness, hospice only begins when a person decides to stop receiving treatment for a terminal illness. Both provide practical, emotional, social, and spiritual support for people and their families. Myth. Hospice is only for people with cancer. Fact. Hospice care is for patients of any age with a prognosis of 6 months or less to live. Reasons for admission may include end-stage cancer, dementia, heart disease, lung disease, stroke, coma, chronic obstructive pulmonary disease, protein calorie malnutrition, and these are just to name a few. Myth. Choosing hospice care means giving up control over my life. Fact. Patients and families ultimately decide when to choose hospice and who will be providing care. The best care occurs when we as your nurses and team listen first and coordinate all your care with you, your family, and your doctors. You always have the option to stop receiving hospice care or change providers at any time, also known as revoke. Myth. Giving my loved one morphine will end their life. Fact. It is common that many patients and family members as well have fears of morphine. A common myth about morphine from patients or their family is that it causes you to stop breathing. A common effect of morphine, which slows a patient's breathing. Hospice care nurses are careful on the amount of morphine prescribed to the patient, so they are not to the point where they stop breathing. Morphine is used when a patient has dyspnea or when a patient has shortness of breath. The morphine becomes a comfort measure to the hospice patient, as shortness of breath is more common as the disease progresses. The main reason for use of morphine is pain management. Another common myth is it is only effective for a short period of time, or if started too early, it will not work later. The body develops a tolerance to an opioid when taken longer than a period of 7 days. Most likely, the hospice patient may require an increased dose of morphine for the desired effect. There are other opioids available if morphine does become ineffective in a hospice patient. These include hydrocodone, oxycodone, hydromorphone, and methadone. It is important to note when used properly, morphine is not only relatively safe, It is very effective in treating multiple symptoms at the end of life. What I do as a hospice nurse. As a visiting hospice nurse, I drive to patients' homes throughout the day. Myself, along with the whole team, oversee a patient's care, including an RN case manager, a social worker, doctor, certified home health aide. I assess vital signs, including blood pressure, heart rate, respirations, temperature, pain level, oxygen saturations. My job is to make sure my patients are comfortable and pain is managed adequately. We complete wound care. We handle peg tubes, Foley catheters, wound vacs, ascites draining. We collect specimens and take them to lab. We order x-rays or ultrasounds as needed. We complete medication reconciliation at every nurse visit, as we never want our patients to be without medications. We report any changes or concerns to the doctors and obtain and carry out orders immediately. Most importantly, we develop friendships and establish a sense of security with our families, as our job is not only to help our patients, but also to help facilitate life as a caregiver for our patients' loved ones, including a lot of patience and knowledge in end-of-life care. Sometimes just an active ear to vent to. We must understand that they are hurting too. And yes, of course, there is death. Death is inevitable. We are there every step of the way, managing pain and symptoms, and when our patient passes, we make the call to have the decedent picked up and taken to the mortuary of choice. But our care doesn't end there. There is always a bereavement team who follows up and makes sure all their needs have been taken care of and met. I love my job and what I do. It has been very rewarding. Yes, very difficult at times, but this is what I tell my loved ones. If not me, then who? God gave me this passion, and I will do it to the best of my abilities. And that concludes my written document. I have also included my references. I reference healthline.com with in-text citations in my document that was provided. I also reference pinnaclepalliativecare.com and Compasses. It's a hospice care website that had 10 of hospice care myths. So I hope you liked my presentation, and I'm open for constructive criticism. Thank you.